Hello everyone, good afternoon. In this session today, I'll be dealing with hand hygiene. Now, people all over the world has been started washing their hands frequently since when the SARS-CoV-19 transmission or the pandemic has been started. So today we'll see what are all the essential aspects of hand hygiene, especially in healthcare settings or for healthcare workers. So here in this picture you can see the transmission of or transferring of the microbes or the germs from one hand to other hand. So the hands are the most common vehicles for the transmission of organisms. So that is the reason the hand hygiene has been recognized as the single most important way to prevent the transmission of infectious agents. So here we'll see what is the history or the background of hand hygiene and the definition of hand washing or hand hygiene, and what are the indications for hand hygiene and the different techniques used for the hand hygiene. Coming to the history or the background, Dr. Ignaz Semmelweis is the father of hand washing. He is the Hungarian physician who introduced hand washing standards after when he discovered the prevention of puerperal fever with practicing proper hand disinfection in his clinics. So he believed that microbes causing infection were readily transferred from patients to patients, the medical staff to patients, and vice versa. So that is why the hand hygiene is considered as the most preventive method for the transmission of microbes or the microorganisms. Coming to the introduction, the hand washing, also known as hand hygiene, which is the act of cleaning hands for the purpose of removing soil, dirt, and any microorganisms. In the medical, hand hygiene refers to the hygiene practice related to medical procedures. The hand washing before administering or after administering the medicine or the medical care will prevent or minimize the spread of disease. The main medical purpose of washing hands is to get rid of or to cleanse the hands of pathogens and the chemicals which can cause harm or disease to the patient or to the other person. And coming to the types of hand hygiene, the first one is the normal hand washing. The second one, antiseptic hand washing. Third one, alcohol based hand rub, which can be used instead of hand washing if the hands are not visibly soiled with blood or any other patient body fluids. And the last one I have is the surgical hand wash. Coming to the definition of the hand washing or the hand hygiene is defined as the act of cleaning one's hands with or without the use of soap for the purpose of removing soil, dirt, and the microorganisms. Okay, so why we are so much concerned about the hand hygiene? Why should you clean your hands? Any healthcare worker or the caregiver or the person involved in patient care needs to be concerned about his hand hygiene, his or her hand hygiene, because as we saw, the hands are the most common vehicles of the transmission of organisms. So that is how the hand hygiene concerns you. So why to perform this hand hygiene? It is mainly to protect the patient against the harmful germs carried on your hands or present on your patient his or her own skin, and also to protect yourself and the healthcare environment from harmful germs. So here I have these 5 moments for hand hygiene defines key moments when healthcare workers should perform the hand hygiene. The moments of hand hygiene are: the first one, before touching a patient. And before you clean or before you start any antiseptic procedure, aseptic procedure, sorry. And the third one, after exposure to the body fluids. And the fourth one, after touching the patient and after touching the surroundings of your patient. So these are the 5 moments when you are supposed to perform your hand hygiene. Coming to the indications for hand hygiene. When your hands are visibly dirty or contaminated with any proteinaceous material or visibly soiled with blood or any other body fluids, you have to perform the hand wash with using non-antimicrobial or antimicrobial soap and the water. If the hands are not visibly soiled, you can go for the alcohol based hand rub for routinely decontaminating your hands. So these are the indications of your hand hygiene. So here I have the picture which is showing most frequently missed areas while hand hygiene or while washing our hands. Or so to prevent or not to miss these areas, we are supposed to follow the proper steps for hand hygiene so that we don't miss these areas while doing the procedure or while performing hand hygiene. So let us see what are all the steps. The first one I have for the hand rub. The steps for hand rub, the duration for the overall procedure or the entire procedure takes 20 to 30 seconds. And this hand rub or the hand hygiene will be used when the hands are not visibly soiled. And the first step here, first you take or apply a palmful of the product in a cupped hand covering all the surfaces, and then start the first step, that is rubbing the hands palm to palm. And then the second step, right palm over the left dorsum with interlaced fingers and vice versa. And the third step, where palm to palm with finger interlaced. And the fourth step, back of the fingers to opposing palms with fingers interlaced. And the fifth step, where rotational rubbing of the left thumb clasped in right palm and vice versa. And the sixth step, where the rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. And then let your hands dry. Okay, so this is the overall procedure for the hand rub, and it needs 20 to 30 seconds, and each step has to be carried out 3 to 5 times. And coming to the steps to hand wash. The first step, first you wet your hands with water and then apply enough soap to cover all the hand surface, and then start with the first step, that is rub the hands palm to palm, and then right palm, second step, right palm over the left dorsum with interlaced fingers and vice versa. And the third step, palm to palm with fingers interlaced. And the fourth step, back of the fingers to opposing palms with fingers interlocked. And the fifth step, rotational rubbing of the left thumb clasped in right palm and vice versa. And the sixth step, rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. And then clean the wrist in rotating manner and then rinse hands with water and dry the hands thoroughly with a single use towel or the tissue paper. So these are the steps of your hand washing, and the duration for entire procedure is 40 to 60 seconds, and each step has to be carried out 3 to 5 times. And coming to the duration of types of hand hygiene, here I have the tabular column which is showing the different methods of hand hygiene and the agents which are used for the hand hygiene and the purpose, the area and the duration. The first one, the routine hand washing, where you use water and the plain soap or the non-antimicrobial soap. The purpose is to remove soil and transient microorganisms. The area covered is all surfaces of the hands and your fingers. It takes around 15 seconds or 20 to 30 seconds. And the methods, second method, antiseptic hand wash, that is your using antimicrobial soap and water. So here it removes or destroys the transient microorganisms and reduce the resident flora, and it covers all surfaces of the hands and fingers, and it needs 40 to 60 seconds. And coming to the antiseptic hand rub, where we use alcohol based hand rub or the liquid, which removes or destroys the transient microorganisms and reduce the resident flora. The area covers is all surfaces of the hand and the fingers, and the duration is 20 to 30 seconds. Coming to the surgical antisepsis, here we use the antimicrobial soap and water, and it removes or destroys the transient microorganisms and reduce the resident flora. And here the hands and the forearms are the areas which are covered, where up to the forearms you are going to wash to remove the debris and transient microorganisms from nails, hands and the forearms up to the elbow joint, and it needs around 2 to 6 minutes. So these are the duration for types of hand hygiene, and the time constraint is the major obstacle for the hand hygiene. So adequate hand washing with water and soap requires about 40 to 60 seconds, and the average time usually adopted by our healthcare workers is less than 10 seconds. The alcohol based hand hygiene requires 20 to 30 seconds. So what we are doing is we only spend less than 10 seconds for the hand hygiene. So the time constraint is a major obstacle for the hand hygiene. So I request all of you to take a pledge of washing the hands properly with spending enough time, so that you can save the lives with washing your hands properly by following all these steps and by spending enough time for your hand washing. Thanks for your patience. Thank you.